Good morning, everyone. It is my privilege to introduce our first speaker for the day. Of course, you would know her. She is the Honorable Dr. Merillee Fullerton, Minister of Long-Term Care. And before I throw it over to the Minister, I'm just going to take a moment to highlight a few things that this government has done recently. Just last week, over 80 new projects were announced that are going to bring over 11,000 long-term care spaces to Ontario, with an emphasis on Indigenous, Francophone, and other community groups, other cultural groups in Ontario. So that is going to make a big difference in the lives of residents and families across Ontario and create new long-term care homes for the future, including campuses of care, which will support residents as they age and progress through the life course. As well, vaccine rollout is well underway, and in early March, it was reported that over 90% of long-term care residents are vaccinated, which is amazing news. And as well, essential caregivers and long-term care home staff are prioritized for vaccination as well. So these are things to celebrate even in the midst of a global pandemic. But I don't want to steal any more of the minister's thunder. So without further ado, it is my great pleasure to introduce the Honorable Dr. Merillee Fullerton, Minister of Long-Term Care. Thank you so much, Minister, for joining us this morning.
Thank you so much, Samantha. It really is a pleasure to be here today, and I welcome everyone. And I want to begin by thanking Samantha Peck. She's your executive director, and she is responsible for managing your sector through this very difficult time with COVID-19. And so I thank her and her staff for their tireless effort during this challenging time. And the insight that Sam and her team have provided ensures that our government continues to invest in and modernize long-term care. And we do so hand in hand with the family councils of Ontario. And Sam, it continues to be a pleasure to work with you and your organization as we navigate an unprecedented time. And so many of the things that we have had to adapt to have required a higher degree of collaboration than ever before. And I am so grateful to you and your team. 6 years ago, many of you may not know this, but I retired from a long medical practice. It was 26 years as a family doctor and almost 30 in the medical field. And the decision that I made to leave my practice was based on family. My father had been ill for a number of years. It had been progressive. And I know that families across Ontario and across Canada are dealing with this on a daily basis. And we were trying to keep him at home. My siblings, they're all in the medical field as well. My mother was the prime caregiver, and we were all trying. And, one day, one of us would be going to find out what had happened with my mother as she was exhausted and had collapsed, caregiver burnout being what it is. And one of us would go to the hospital and find out what was happening with her. And the other two would try to provide that 24-hour, seven-day-a-week care to my dad. And, it wasn't sustainable. And so, I think of all the families who are going through this and trying very, very hard to keep their loved ones home. And there comes a point where you can't do it anymore. And so in our family's case, we had to take the first available bed. There was a crisis. My dad needed hospitalization. And of course, we wanted to do our duty to the healthcare system as well. And so we took our first available bed, and it happened to be at a distance. And, my parents had been together for almost 60 years at that point. And to be separated like this was just so difficult. And so we all rallied to try and get my mom to be able to see my dad. And it's one of the reasons why I left practice. And my patients understood. They were very understanding. But my point in all of this is our situation wasn't unique. It is really happening across the province. And many of you have the same story. And so as I speak to you today, My mother is still in her home. She's 88. I'm taking her to get her vaccine on Friday. And I know we're all doing everything we can to support our families. And groups like the Family Council of Ontario are so incredibly important. And I speak to you today knowing the vaccines are on the horizon. Some of you have already taken family members to get the vaccine. And others like me are getting our families there soon. So the arrival of the vaccine means that there is tremendous hope and that we have protection for our residents. And if we look at the dramatic improvement since we've been able to get about 99% of our residents vaccinated and the staff almost to 80% vaccinated, this is tremendously hopeful. And so we need your input to help us develop programs as we move forward into a new era. We know that we're not out of the woods yet. The variants are there, and we have to be continuously vigilant and cautious and working with our partners and the science to understand what risks there are and how we can gradually open to allow families more participation. And I know we have the essential caregiver designation, but as times improve, we will be looking to open up further and value your insights. So because you know better than anyone what's best for your family members, we need to create and maintain this level of collaboration. And you all know that the pandemic has shone a light on the many shortcomings in long-term care. And this sector has been neglected for decades. I've been looking at this sector for almost 15 years, for 14 years, and studying this sector, understanding the importance of home care, understanding the importance of integrating long-term care into the whole healthcare sector, and how we can do that in a meaningful way so that residents can get the support they need over the transitions and that the families can be part of this. As a family doctor, I know too well that families are impacted by illness, whether it's acute or chronic. And we need to do a better job of this. So the changes need to be made. They need to be made now more than ever before with an aging population and with the exposure that the pandemic has created to the shortcomings. So we need more spaces, we need more staff, we need more hours of direct care. And the wait lists, 38,000 people on the wait list, and that's grown. So, and with an aging population, we're on a trajectory that we need addressing on an urgent basis. So we need to ensure that our loved ones receive the quality of care and the quality of life that they deserve. I've often said long-term care is a place to go to live. It's not a place to go to stay. It must be a place to live out the remainder of your life, and your family must be engaged in that. We must have staff that care. And we've seen that, the tremendous heroic frontline efforts by staff during the pandemic. So our government values people, and it values the collaboration. And working with people across the sector, like the Family Councils of Ontario, we have to act with speed and efficiency. And I know that seems perhaps a little funny to talk about government acting in speed because typically governments don't, but the sense of urgency is here. It's absolutely apparent to me, to the folks who work in my ministry, and to our government. So we have already started implementing our historic staffing plan, a plan that will create 27,000 positions for long-term care for personal support workers and nurses within 4 years. And that work has already begun. The frontline workers will be critical to delivering the 4 hours of direct care. And that is a really important point because right now we don't have the workforce to instantly mandate those 4 hours of direct care. That will take some time, but the ability for us to attract people with the pandemic pay, we were able to hire on over 8,600 people into long-term care with the pandemic pay, shoring up our system and getting ready for the second wave. And we've innovated with programs like the Community Paramedic program for long-term care, which has demonstrated the significant requirement to help people stay in their homes longer. That's often where people want to be. I know that's where my mother wants to be. And that program is providing our loved ones with support that they need in the comfort of their own home while they wait for long-term care. And this provides tremendous peace of mind when you can have 24-hour 7 response So we're increasing our capacity with over 20,000 new spaces being built so that our loved ones will have the access to the safe and modern spaces they deserve. So this is tremendously hopeful, and we're being innovative and looking at the connections between long-term care and primary care and acute care through the community paramedicine program and with the innovations that we will continue to make with this foundation. So our government is using every tool that we have available to us to address the issues in long-term care, and we are innovating. And we know that the policy input by FCO and others that they bring to the table is incredibly important. We must keep these channels of communication open. And it's by working together, working with our partners, that we will come up with these innovative solutions and address the challenges that have impacted this sector for decades. And it is by collaborating that we will make the long-term care system a better place to live and a better place to work. And ultimately, it has to be a place where our loved ones can be cared for with respect and dignity, and where families can be integrated on a daily basis. So this work is continuing. We started this work as soon as we had become a ministry, and I look forward to continuing this work with FCO and all of our partners and individuals who are being so responsive to the needs of long-term care. And I want to again say how grateful I am to Sam and her team and to everyone on this call. It is your dedication, it is your commitment that is making a difference. And I'm so grateful for all that you're doing and to be a partner with you as we move forward to repair and advance long-term care to support our loved ones. So thank you for doing what you do every day. Very much appreciated by me, my ministry, and the government. Thank you.
Thank you so much, Minister, for those lovely opening remarks. I really just want to echo what you said around the importance of family caregivers in the sector and how essential their input is to improving the lives and conditions of long-term care now and planning for the future. And so as Executive Director of Family Councils Ontario, I can say without a doubt that my team and I are committed to working with you and your colleagues on aspects such as the staffing plan, the new resident spaces that are opening up, informing models of care, and so on. So we are with you in this journey, and we so appreciate your support of our work and your love for families across the system. So on behalf of everyone today, thank you so much for providing such lovely opening remarks.
Thank you, Sam, and thanks to everyone so much. Take care.
You too. All right, everyone. Thank you for your patience with our hiccups. This is the first time we've used this platform, but it's a learning experience for everyone. So thank you so much. We're going to be transitioning to the next presentation now from Associate Deputy Minister Hanna. Thank you so much, everyone.